Well, David, now that you have this wonderful tailored jacket, I'm curious about your thoughts on tailored medicine for glaucoma. What do you think about that?
You're touching upon what's become one of my favorite topics, the levels at which we can now nuance and tailor or customize glaucoma care has become remarkably detailed and somewhat confusing, because if you look at the span of glaucoma treatments, now there are probably 40 different individual procedures or potential along that spectrum, whereas at one point, or originally, there were drops, trabeculectomy, glaucoma drainage devices, and virtually nothing in between. Laser was down here, but then with MIGS, and then now the subconjunctival MIGS, there's a population of about 30 different procedures along the way. You can consider each of them individually, but more importantly, in combination to achieve specific targets. The canaloplasty is my favorite because of its versatility, and this in combination with other MIGS procedures or other glaucoma procedures and medications is one of the many ways that tailoring can be achieved.
Now, David, if I were to make you say 10 tailored jackets, would there be more or less ways to tailor your glaucoma treatment options than that?
I would say presently there are more than 10. More than that, especially if you start looking at combinations, there are probably 40 possible combinations. I've tried to...
Do I need to interest you in a walk-in closet by chance?
Yes, and a personal tailor, okay. Which you are. You've become that, so thank you for that. For peace of mind, I've distilled my treatment into a few algorithms which are fairly easy to follow based on the severity of the glaucoma and whether the pressures are controlled or not controlled. And then the third factor is whether or not it's being combined with cataract surgery or as a standalone procedure. So you take the three categories, and then the severity of glaucoma. You can pick fairly simple paths forward for almost all patients.
Well, changing topics for a moment, we were in a myopia glaucoma related symposium yesterday, and you mentioned that in the United States the topic of myopia doesn't get as much attention, but you learned something at dinner the other night. Can you tell me a little bit about that?
Yes, I'm absolutely fascinated by the level to which myopia is a topic of discussion here at an ophthalmology conference. I don't recall much at all the American congresses, in the ophthalmology congresses about it. At dinner with a glaucoma specialist, Singaporean, she referred to going outside with her kids as myopia prevention. And her children are 3 and 1. She's myopic. And if you're thinking about your free time with your kids as a treatment for potential myopia, then that says a lot about how societally or culturally it's an issue of importance.
And we understand now that high myopia, if left untreated, could lead to other complications in the posterior segment, perhaps in the glaucoma area. But what do you think about that? Do you think it is a cause for concern?
I look at this, as I do many things, in a Bayesian reasoning, which is that we all understand that the more myopic an eye, or the greater the axial length, the more prone it's going to be to many things. So normal tension glaucoma, high tension glaucoma, retinal pathology, long-term vascular issues, perhaps increased macular degeneration. So if the enlarged eye is a state which is more likely to have these things, and preventing the eye from getting as large as possible, then we don't know this scientifically to be the fact, but we have to intuit that perhaps if we can reduce the level of myopia that a person would develop, we can therefore also reduce the likelihood of any of these other subsequent pathologies arising.
That also sounds to me like perhaps many more eye care professionals are needed for screenings and even maybe aftercare treatment after major surgical operations. Do you think that community eye care needs to get involved more?
I suspect that our optometric colleagues have been discussing myopia and myopia prevention for a long time. And the fact that we as specialties haven't had a cross dialogue is regrettable. I think that this will be the topic that will bring a collaboration between optometry and ophthalmology, ultimately for the better of our patients overall and for the better of our specialty. The territorial nature of ophthalmology has had its benefits, but ultimately anytime a group of professionals try and isolate themselves from a larger body of knowledge, it will have detrimental effects. So I'm fully supportive of open dialogue and collaboration with ophthalmology and optometry and biomedical engineering. And of course, the contact lens industry is going to have to be very much involved. It's several stakeholders will have to come together to address this successfully.
And I mean, you speak from experience because you yourself are a bit of a Renaissance man. You have a background in craftsmanship related to metals, as I remember. So as someone who has really tried to understand both the expertise within ophthalmology and outside the fields, what is the benefit of bringing all this together?
I would say that a third of my critical learning has come about ophthalmology or eye care has come from people outside of medicine or outside of ophthalmology. And again, this is just people who are either inspirational in their thinking or very innovative in other realms. So being able to learn how to learn differently is something which I've strived and hope I've been successful at times. And another third of my clinical knowledge or interest has come from people within eye care, so outside of ophthalmology, but within eye care, either industry or optometry. And then the final third are from my mentors and teachers in ophthalmology, most of whom have at times in their career been considered outliers. So always pay attention to people within your field and outside of your field who are rethinking or reimagining how to do what we do.
So David, also, as a media company, what can we do to help raise awareness in the eye care field about critical issues that are important to ophthalmologists?
For me, the overwhelming volume of information that's available is it's difficult to access. It's difficult to know where to find the most critical and most valuable pieces of information. And the fact that information is largely free makes it hard for me to sort, right? Hard for me to sift through and find the pieces which are of most value. And traditional media has not done a very good job. And honestly, even our meetings, our congresses have not done a very good job helping to pull individuals toward the things which matter the most. I think that you and other alternative media systems provide a pipeline to relevant information that wouldn't normally get tracked through traditional media outlets, journals, and even the Congress, official Congress programs. As a non-digital native, I'm counting on a creative and innovation-based company like you and others, but you're the one I know the best, to just have an alternate pipeline. Okay? And then within your system, you're going to have different people evaluating. I value your perspective and your team's perspective for finding and presenting new and useful information as much as I look to my peers and colleagues.
David, thank you for the compliment, brother.
My pleasure.
I sure appreciate it. So kind of you. And we will continue on this mission of innovation and education moving forward for the best possible purposes.
Congratulations. Thank you.
Thank you.
Thank you very much.